Hi everyone, Peggy Dimitro here. So I want to talk about briefly some odd thing that's been going on, I'd say more recently. I've noticed that there are patients that believe if labs are ordered either by themselves or by a physician or a nurse practitioner, that they can then obtain their lab results through the lab portal and then decide what's normal and what is not normal based on the reference range of the lab. So this is a PSA to let everyone know that there is much more involved in lab interpretation than what is being seen. So according to studies, NIH has a good one. About 90% of lab interpretation has nothing to do with the actual lab value. It has to do with the clinical assessment, the patient history, their family history, their social history, and a lot more even in addition to that. So we use all of that information to actually interpret your lab results. If you call a lab, let's say Quest, and ask, hey, are these reference ranges normal or accurate? They're going to tell you either no, or it is up to the provider to determine what is normal and not. So I'm letting people know because there's a lot of misdiagnosing, self-diagnosing going on, and unless you are trained medically, you are not qualified to make that lab interpretation. That is why you see a trained medical profession. That is why a visit is needed, an assessment is needed in order to help you properly. So let's please stop the nonsense and understand why things are done the way they're done.